Welcome to our Health Assessment Lab. Health Assessment Lab has a lot of uses nowadays with COVID. We're using it not only for our students learning health assessment, obviously, but all the students that need makeup hours for being sick or missing clinical, we're using this lab as well for that. And the faculty have been very innovative in coming up with creative ideas on how to meet the students' needs, how to give them more of an experience when we have been turned away from COVID. So in this lab, you can see it is set up more like a doctor's office, and that's where they learn their health assessment skills. So the sophomore ones are starting their basic skills. The graduate students learn their advanced health assessment skills in this lab. The other thing that it's used for is our forensics department. And those students use this lab for a multitude of different things. They will set it up as crime scenes. They will bring in speakers from all over the country. They do a lot of photography in here of wounds and such. So it really does get a lot of use other than just your health assessment. So we've also used it as a classroom, but typically and basically it's mostly used to teach the health assessment skill. Welcome to our community lab. The community lab, we actually, when this building was built, we inherited it from the health sciences department. So as you'll see, there's multiple stoves, dishwasher. We don't really use that here in the School of Nursing. What we do use this for is a community type setting. So our community students will use this, our forensic students will use this lab. They will set it up as an apartment, maybe a crime scene or such. We've done some projects with our nursing students, and we have an obesity suit. And we put a student in it actually, and it simulated someone who was markedly obese, and they had to figure out how to get this person out of bed. And it was a wonderful learning experience for the student because the student that was in the suit could see the expression on the other students' faces when they came in to realize that they had this very large person and how were they going to move them. So from the student's perspective in the suit, it was a real good learning opportunity. For the students that actually had to do the physical work, it was a great opportunity because they had to figure out how to move this patient safely so that they wouldn't be hurt. So that was a great experience that the students had, and we use this lab for that. And the thought process is that we might convert this into another simulation lab down the road in the future because our simulation is expanding so much and we just need more space. But typically right now, that's what this lab is used more for a home type setting. We've put a senior living here, and then we've kind of made booby traps, and the students had to figure out what was unsafe for that environment. So we've been very creative with this space. Haven't found a reason to use the 4 ovens yet, but for the nursing part of it, we really use this as a home type setting, and it is very realistic, and it really helps the students get into that mindset, not in the hospital mindset, but in a community type home set learning environment.